Hello everyone, my name is Yosefina Gerslapagi with last 3 digits to the ID number 087, and I will going to explain about the chapter 1. The first one is background. Diabetes mellitus is a chronic non-communicable disease in the form of a heterogeneous metabolic disorder whose main finding is chronic hyperglycemia caused by impaired insulin secretion or varying degrees of insulin resistance or caused by both. According to 2018 risk assessment data, the prevalence of DM in Indonesia based on blood tests in residents aged more than 15 years from 2013 until 2018 increased from 6.9% to 8.5%. The role of family medicine is important and significant in the prevention and early detection and prevention of complications of type 2 diabetes mellitus. This is the reason why the plan of family medicine approach to treatment the type 2 diabetes mellitus is very necessary for the community, especially patients and their families. We're going to the next one, problem formulation. So the first one is, what is the definition and pathophysiology of diabetes mellitus type 2? What is the examination of diabetes mellitus type 2? What are the risk factors of diabetes mellitus type 2? What are the complications of diabetes mellitus type 2? How is family interaction related to diabetes mellitus type 2? How does the diabetes mellitus type 2 disease impact the family? How is family medicine approaches and prevention of diabetes mellitus type 2 disease? And here are the objectives. First one, to know the definition and pathophysiology of diabetes mellitus type 2, to know the examination of diabetes mellitus type 2, to know the risk factors of diabetes mellitus type 2, to know the complication of diabetes mellitus type 2, to know family interaction related to diabetes mellitus type 2, to know the diabetes mellitus type 2 disease impacts family, to know family medicine approaches and prevention of diabetes mellitus type 2 disease. And here is the benefit. The benefit of this writing for the student as future medical practitioners is to understand the plan of family medicine approaches for diabetes mellitus without complication. I think that's all from me, and thank you.
Hello, my name is Fira Jonathan. With my last 3 name digit number is 164. So I'm going to continue the presentation about the definition and the pathophysiology. So diabetes mellitus or DM is a severe public health problem that affects over 400 million people globally, which is caused by a lack of insulin secretion, pancreatic beta cells injury, or insulin resistance. DM may lead to complications such as nephropathy, neuropathy, cardiovascular and renal problems, and retinopathy. There are 2 types of DM. The first one is type 1 diabetes or T1DM. This is an autoimmune condition that affecting the pancreatic cells to impair or reduce the production of insulin. And the other one is type 2 diabetes or T2DM, which is a result of the impairment of pancreatic beta cells to limit the individual's ability to use the insulin. T2DM is one of the most common metabolic illness in the world, and it is commonly caused by a combination of 2 major factors, which are disabled by insulin secretion by pancreatic beta cells and the failure of insulin-sensitive tissue to respond to insulin. Failure in any of the systems involved while resulting in metabolic imbalance, which may lead to the pathophysiology of the T2DM, which will be continued by my friends. Thank you.
Greetings, my name is Vidya Sudana with the last 3 digits of student ID number 108, and I will be continuing the explanations of pathophysiology of diabetes. So type 2 diabetes is characterized by insulin resistance and beta cell dysfunction. In the early stages, there is a compensatory rise in insulin secretion, maintaining glucose levels within the normal range. And as the disease advances, however, changes in beta cells result in insufficient insulin secretion, leading to the inability to maintain glucose homeostasis and the development of hyperglycemia. That is all from me. The next one will be continued by my friend.
Thank you for the opportunity. My name is Fiona and I would like to explain the anamnesis of a patient with type 2 diabetes. Well, patients with type 2 diabetes can come with various kinds of complaints. However, one of the most common is increased thirst, frequent urination, often feeling hungry, or delayed wound healing. Now, the location of this complaint can be dependent on what they feel. However, it is most commonly systemic and the onset is often unknown as it is most commonly a progressive complaint that can reach over a few months back. The quantity and quality is also variative, and the modifying behavior that can exacerbate the symptoms could be exercise and could be relieving by doing rest. Now, the fundamental four of the anamnesis part can include present medical history, for example, is hypertension, obesity, and dyslipidemia. Wherever past medical history can also include cardiovascular diseases. Oftentimes, people with type 2 diabetes also have a history with family where some family members may have experienced gestational diabetes, normal diabetes, or cardiovascular diseases or metabolic syndrome. Social skills and social behavior may also include sedentary lifestyle, poor nutrition, smoking habits, and also alcohol consumption.
Hello, my name is Alexander Harsansa with the last three-digit number of 011, and I would like to explain about the physical examination of diabetes mellitus. The physical examinations of diabetes mellitus includes some examinations, for instance, skin. The healthcare professional will examine the patient's skin to look for any indications of diabetic neuropathy or diabetic dermopathy. Wounds and skin lesion can serve as early warning signs of problem with inadequate circulation and nerve damage. Eyes. To check for diabetic retinopathy, a frequent and potentially dangerous eye consequence of diabetes, a dilated eye examination may be conducted. The medical professional may also look for additional diabetes-related ocular disorders. Neurological assessment. To identify any indication of peripheral neuropathy, a frequent diabetic consequence that affect the nerve in the extremities, a comprehensive assessment of the patient's neurological function is necessary. This evaluation should include tests for sensations, reflexes, and muscle strength. Food examination. As common complications of diabetes, the health professional will look for symptoms of ulcer, callus, or infection on the patient's feet. It's also crucial to feel for pulses in the feet and look for any sign of peripheral vascular disease. Next is cardiovascular assessment. Since people with diabetes are more likely to experience cardiovascular complication like heart disease and stroke, listening to the patient's heart for any unusual sounds, examining the patients for the peripheral edema, and looking for the sign of vascular disease are all important parts of examinations.
Okay, thank you. I will continue again with the additional examination required for type 2 diabetes patients. The first one is the blood glucose monitoring, where we do fasting blood glucose, and it is determined by if it is above 128 milligrams per deciliters. To our postprandial blood glucose above 200 and HbA1c above 6.5%. Other than that, we also do head-to-toe examination to know the general condition of the patient. One key thing to keep in mind is the complications that can appear in patients with type 2 diabetes. The first is in the eye, where patients can also experience diabetic retinopathy. That is why we do funduscopy to evaluate the fundus. The next is kidney function test to evaluate if there is kidney damage due to diabetes. And the last could be done is neurological examination, most especially in the extremities, to evaluate if there is neuropathy caused by diabetes. The next thing to evaluate is the comorbidities such as metabolic syndrome. That includes examination of the blood pressure and lipid profile of the patient to know if the patient has CVDs, risk of CVDs, or obesity. The next thing to keep in mind is the nutritional status, where we evaluate the needed calorie intake for the patient. We evaluate the input of micro and micronutrients to evaluate if there's any deficiency. And we also we actually evaluate the energy expenditure of a daily type 2 diabetes patient. That is all that I can accommodate. Thank you. The presentation will be continued by my...
Hello, doctors and friends. My name is Zaki with last digit of stream number 122. So today I will explain about the risk factors of type 2 diabetes mellitus. Diabetes mellitus can develop according to combination of risk factors. Some are inherent risk factors such as family history, age, race, and ethnicity. On the other hand, there are modifiable factors such as obesity, poor lifestyle, and smoking. The other risk factors include high level of serum uric acid, cardiovascular disease, dyslipidemia, and hypertension. Maybe that's all for risk factor. Thank you.
Okay, so hello everyone. My name is Dr. Desina Dewi Pemayun with the last 3 digits of my student number is 165, and I will explain to you about family interaction of diabetes mellitus type 2. So in the setting of chronic illness itself, families are the one of the most important and powerful social units that can support or undermine health. And families influence physical health through a lot of mechanisms, such as biological mechanism like heredity, through psychophysiological pathways like stress reactions in marital conflicts, and through influencing health behaviors like food, exercise, and seeking or adhering to medical treatments. Relatives have a markedly increased chance of getting type 2 diabetes in families where there is a person with the disease. Lack of perceived disease relevance is a major barrier to positive intra-family communication about risk reduction, prevention, and familial risk. So that's all from me. Next will be continued by my friends. Thank you.
Hello, doctors and friends. My name is Zaki, legit of student number 122. So today I will explain about the complication of type 2 diabetes mellitus. Complication of type 2 diabetes mellitus can be divided into acute and chronic. The acute complications are diabetic ketoacidosis, hypoglycemia, and hyperglycemia, whereas the chronic complications include macroangiopathy, diabetic foot, retinopathy, nephropathy, and neuropathy. Maybe that's all from me. Thank you.
Greetings, my name is Theodore Mansina Baban with relax digit number 093. I'll explain you about the disease impact to family. There are a lot of impact that diabetes mellitus can brought to a family, like emotional challenge, financial challenge, and maybe some lifestyle changes. But I'll explain to you more about the emotional challenges. Diabetes patients and their families are impacted by stress that come with the conditions and new lifestyle changes, like new dietary, maybe new healthcare, new drugs, a lot of drugs, and also new some kind of physical activity. And that may change the behavior of a family, and that may change the behavior of some individuals and impacting to the family. That's all from me. Maybe my friend will explain more about the financial challenge. Thank you.
Hello everyone, my name is Trifana Lisanias with the last 3 digit of the number 119. Today I will explain to you about disease impact to family, especially in financial aspect. Family facing financial challenges because of the cost of prescription drugs, supplies, medical bills, and the treatment of diabetes patients. Family budgets may be strained financially by the cost of those sudden needs of the patients, and also it's usually long-term, so it is necessary for the diabetes patients. That's from me. The presentation will be continued by my friend. Thank you.
Hi everyone, my name is Yaninta Ayuardetindupari with my last 3 digit student number is 159. And now I explain about the family medicine approach. So for the patients with diabetes mellitus type 2 related complication, family medicine plays a significant role, which are managing a lifestyle modification of the patients, medication management, encourage patients to measure their blood glucose levels, maintaining a psychosocial support, educating patients, making a team approaches, individualized care plans, and schedule follow-up sessions. And also the most important part is also encourage their family to make a community resources and support groups for the patients. So there are from me. Thank you.
Greetings everyone, my name is Tias Parita Wirawan and my student ID number is 200251182, and I would like to continue the presentation about the prevention of type 2 diabetes or diabetes mellitus without complication. The first one is primary prevention. It can be done by doing some education and promotion about the disease and the risk factors and how the lifestyle modification such as dietary and physical activity can affect the patient. And the second one is secondary prevention. It is aimed to those who are healthy individuals with subclinical forms of the disease. It can be done by performing some tests such as blood chemistry assays or questionnaire of risk factors to define prediabetes. The last one is tertiary prevention to reduce the severity of the disease outcome. In this case, it is cardiovascular disease risk. It is important to screen and treat modifiable risk factors to lessen the progression of cardiovascular disease. That's all for me. Thank you.
My name is Winnie Chandra with the last 3 digits of student number 027. I'm going to talk about the conclusion. So the conclusion that can be brought from these student projects are: diabetes mellitus is a severe public health problem that affects over 400 million people globally, which are caused by a lack of insulin secretion, pancreatic beta cells injury, or insulin resistance. The examination of TD2M consists of anamnesis, physical examination, and additional examination. Chances of person developing type 2 diabetes depends on a combination of risk factors that are modifiable and unmodifiable risk factors. Families influence physical health through direct biological mechanisms like heredity, through psychophysiological pathways like stress reactions in marital conflict, and through influencing health behaviors like food, exercise, and seeking or adhering to medical treatments. Type 2 diabetes mellitus complications can be divided into 2 categories, which are acute and chronic complications. Families with diabetes mellitus face significant emotional and financial challenges in managing the disease, which is increasingly important to provide emotional support. Family medicine methods to type 2 diabetes management frequently include a thorough and holistic approach that comprises a collaboration between the healthcare professional and the patients. Lastly, there are 3 levels of prevention that can be done during the natural history of a disease, which are primary, secondary, and tertiary prevention.